Now let's look at a social development issue, talking about health. The 2020 budget proposal on health and the performance of the 2019 budget, especially as it concerns immunization, polio eradication, family planning, and childhood killer disease. And to do this, we do have the project director, South Saharan Development Organization of the Partnership for Advocacy in Child and Family Health, Dr. Stanley Elechukwu. Thank you for joining us.
Good morning. Thank you very much.
We also have the chairman, Nigeria Association of Nurses and Midwives of Nigeria, project director, PACFaH Scale, Kaduna State, Bartholowme, Sarti. Thank you for joining us.
Thank you, but let me call the full name of our association. It's not just Nigeria Association, but it's National Association of Nigerian Nurses and Midwives, abbreviated as NAM.
Good to have you join us.
Thank you.
First of all, what's the mission of PACFaH Scale in Nigeria?
PACFaH Scale in Nigeria is here to advocate for budgetary allocation for the health sector with specific emphasis on family planning, routine immunization, childhood killer disease, and primary health care under one roof.
That's what it's about?
No, that is the mission.
Okay.
Yes.
Dr. Stanley,
Yeah.
Tell us a bit about this advocacy concerning family health and the 2019 budget performance as far as health budgetary allocation is concerned.
Okay. Over the last couple of years, Nigeria has steadily increased budgetary allocation to family and health issues. But unfortunately, 2019 there was a huge drop, a huge dip in funding, especially for family planning. We were unable to meet our counterpart funding for family planning from about 1.2 billion naira to about 300 million naira, and that drop was very significant. And then we decided that it should not happen again, so we should begin advocating for commensurate increase this year, start early, so that the issues that happened last year won't happen again. Funding for health is a very big issue, and we know that maybe the issue might be last year was an election year, so things don't happen as fast. But then again, health doesn't mind if it's an election year or not. People still fall ill, and it's not wise that we let that key sector of our economy, being the health of the citizens of the economy, to fall short while other things are going forward. So health should be brought to the front burner, as it should be, and not being placed behind, as has been the history of health budgets in the country. But bringing it forward, and I'm hoping that this year things will change for the better. If we begin early advocating for increased funding for health issues, we hope that the National Assembly and those in charge will take notice and make adequate corrections to the cost of the funding costs over time.
This advocacy has been on the need
Yes.
for governments in Africa, for instance, to increase budgetary allocation to health. And in Nigeria specifically, I think the highest that the country ever did was about 5%
Yes.
in 2016 or so.
Yeah.
Now, how do you think the current administration is faring as far as budgetary allocation is concerned?
Well, from the feelers we're having so far, I think they might try to change course. Given the events that happened last week at National Council on Health, where the minister was also there and gave assurances that some things that they had done before would change. And some of the assurances they gave were what's it called? Some of the actions, the good faith actions they showed, were like they released funding for the Basic Healthcare Provision Fund for some of the states that have applied for it. And then we hope that small good faith that they've shown so far, if we continue to advocate, they might change course. Remember, in 2012, they promised that the government promised that they would increase health funding to about 15%, and right now it's about 5%. If we can go, no matter how little it is, a percentage or more higher, and keep working on that over time, we hope that we'll reach there very soon.
All right, 15% was what the government promised in 2012.
Yes.
Years has gone down, yet we're still on 5%. But let's talk about the 2019 budget. How did the health sector fare?
Well, as it has been stated, there was actually a reduction in respect of the budget In fact, the actual percentage in respect of that 15% is 4.75, even though it's closer to 5%. So maybe it can be approximated to say to be 5%. But the information that we have is that at the budget is only personnel costs that have been released, 100%. But for now, 0% for capital project as far as health is concerned. And that is a serious concern because, of course, we have the personnel, but the personnel equally require equipment to work with. And sometimes, again, even the structures that we have on the ground, they could require rehabilitation. The equipment we have, they can break down. Some will break down to the extent that they will be required to be replaced. So where there is zero allocation in respect of capital expenditure for health, it now means that we'll have poor or inadequate health infrastructure.
How do you mean inadequate health infrastructure? We do know that that's a major problem in the country, inadequate health infrastructure.
Yes.
But I think in 2018, the government did make provision for the construction of a cancer center and, of course, counterpart funding for immunization in the country. So when you say that this budget is usually geared towards personnel costs, does this major step by the government to increase investment in immunization and the construction of cancer center not indicate that the government is indeed doing something?
Okay, it is one thing to indicate and show interest. It is one thing to have a budgetary allocation. It is another to have financial backup. And the last is for the release of that financial backup. As it is now, even the counterpart funding we are talking about, for instance, you said UNFPA and others who contribute their own funds. The government have not yet met their own commitment, and that is always the problem. Most often we enter into MOU with donors, and they fulfill their own commitment, but when it comes to government side, we rely more, if not all, on what the donors have contributed. So I'm just trying to say that the commitment towards making of counterpart funding is very low.
All right, zero allocation for capital expenditure, equipment in very bad states, and of course personnel. He has said there are personnel on ground. Even though we've had reports of some health practitioners leaving the country for greener pastures. But then, let's look at this holistically. Okay. How has this affected the health sector?
The health worker flight out of Nigeria, right? It's not a good tale. As I'm aware, let me take for example my own graduating class when I finished school. I think of about 90 that finished from my school back then. Less than 30 are still in the country. So every year, health workers are leaving the country in droves. As of last 2 weeks, a friend of mine just left. And if it continues at this pace, very soon Nigeria would, in fact, we are training health workers for other countries to absorb. And it's so bad that even in rural areas, you won't see doctors. Nurses now are becoming scarce commodities. Before, the whole thing was, okay, you won't see doctors, but you might see 1 or 2 nurses. So it makes sense. You say, okay, you can manage with that. But right now, you're not seeing doctors, you're not seeing nurses. What we have in rural areas right now are community health workers. People that have had like 2 years of training. And that's why some of the policies, the government is aware of this. That's why they are now bringing up some policies like tax shifting and tax sharing, so that we could train those health workers in the communities to offer some of those tasks that nurses could offer before. And though these are supposed to be stopgap measures, but they might end up being permanent because we don't see the new crop of health workers coming to fill those gaps. They may end up becoming like that for a very long time if this hemorrhage of health workers is not stopped at any point in time. And all these are tied to funding of the health sector. So you fund the health sector, personnel, those are the front lines are not taken care of well enough, they're not trained, the equipment they need to work with are not available. So they tend to themselves, so why do I bother? Why do I come to work? Why would I put all my energy in trying to save lives when the tools I need are not available? And then they make up their minds. let me just fend for myself. The government doesn't care. Why should I care? And they leave. Now,
dovetailing from your points, what's the impact of this on routine immunization as regards what they call the polio eradication in the country? Yeah, for example, right now, so
the personnel you need for routine immunization currently are going down almost on a daily basis. So when the time comes for parents, kids to be immunized, there are no personnel to have it done. Those that are available, maybe the new crops that have come into the sector, are not being trained. So you have a woman coming in with her kids for routine immunization, and either the vaccine is not available, and if it's not available, the person to give the vaccine is not trained to do such and can't offer the service. The lady goes back with her kid, and the kid is exposed. Same thing for family planning. Most of these monies that are being budgeted are monies that go for buying commodities and also for training those on the field. So it makes no sense that I have commodities on my desk and then in store, but I can't offer them. And these are things that require high level of skills to offer. So women come in seeking the service. Maybe a lady had just delivered a few weeks ago. She has like 3 or 4 kids already at home. This is her 5th child. And she says, and she walks out with her husband that, okay, let's stop for now. Let's not have any more. And the husband said, okay, let's go for family planning. And you go to your nearest primary healthcare center. Let's hopefully they have the commodity, but the lady there can't offer it. She doesn't know how it's done.
No expertise.
Yes, she's not there. She was supposed to have gone for a training maybe a couple of months ago, because there was funding shortfall, she couldn't go. And the commodity stays there, wastes, expires, until end, nobody gets anything. She goes back and is at risk, gets pregnant again.
I'm looking at the budget of allocation to the health sector. Yeah. In 2017, it was about 340 billion naira, and that figure has not changed significantly between 2018 and 2019. Why do you think we keep hearing or keep recording these cases of, insufficient equipment and lack of expertise in Nigerian hospitals?
Well, Nigeria is a very large country. 190 million is not a small. It's not a small number. So you have your population you have to cater for are quite large and quite diverse, and they all spread along a very big, huge landmass. So whatever we bring in is a drop in the ocean. So PACFaH Scale, as part of our mandates, is that we are trying to mobilize funding, not only from the local sector, but even from the private sector as well, to push into the health sector, hoping that as all these fundings all come in, some of those gaps that governments can't fill can be filled by the private sector or by philanthropists. And also, one of the things we're also looking at so far is that we know government can do all, but they've promised to do some, and we show them to their word on that. On the flip side, since most people pay for health through their pockets, we're also encouraging people to go for the health insurance schemes, and that way you put in less and you get to have much more coverage. Most states are adopting that right now, and we hope that it will scale up to other states, and the citizens of those states would benefit from it. But it requires a whole lot of advocacy on our part, civil society, the media, for everyone to do what they are supposed to do at the right time, and have our citizens, beside those in the rural areas, beside the women and the children, not suffer from the adverse effects of this poor funding for health.
Bartholowme, what do you think the state government should do at this point? The primary healthcare system in the country, the state governments do have a role to play in that regard.
Yeah, the state government has a significant role to play, not just the state government, including the local governments. Primary healthcare is all about making health affordable, accessible, available to people. And Nigeria have adopted the primary healthcare under one roof policy, but as it is now, not all the states have actually taken it, where it has taken off. There are some, because there are conditions that need to be met. You have to have a board for the State Primary Healthcare Development Agency. You have to have structures that could accommodate the offices. And outside that, you need to have adequate personnel to meet up with the basic primary healthcare requirement standard for a primary health center, a health center, and so on and so forth. So we are equally saying that state government should take up their responsibility to complement what the federal government is doing in respect to healthcare provision because primary health care is very essential, because it is the one that is closer to the people. It is the one that people can access easily without much stress to travel from long distances in order to access it. So we are strongly advocating that all state governments should support the primary health care delivery system.
Your projection for the 2020 budget proposal?
Okay. We're hoping that the shortfalls of 2019 will be corrected in 2020. Along with that, adequate provision should be made, not only for the shortfall, but to make it, take it back to where it was ab initio. So, for example, the shortfall for family planning counterpart funding, which was supposed to be 1.2 billion on a yearly basis, last year was 300 million naira. So we had a deficit of about 700 million. Now add that to what is supposed to be this year. So we hope the government sees the need to live up to its obligations and fund adequately its own part of the agreement, along with other ones as well. The one for immunization as well, the one for other childhood killer diseases as well. So these things require adequate funding, and we hope that they would, at this early point when it's still being drafted, these things should come into play and the funding should be made available.
When the government says capital budget for health, what do you figure that means? Because most times when the government says capital, makes allocations for capital projects, sometimes they engage in procuring equipment, which of course may not necessarily be what should be the case.
Well, sometimes those are quite essential. For example, this capital budget will go into waste equipment, go into personnel training, special equipment in those rural areas where you have most of the PHCs in the country right now. Their basic function primarily is what's called managing women and children. So deliveries, immunizations, family planning, those kind of things are the basic things that they should offer. Now you go to their delivery rooms, you will not see a couch where the women can give birth. No running water, where you can wash up after delivery. So basic things that they need are not available. So those monies that are being budgeted for that are used to fill those gaps, and also for building capacity. And also, if I forget as well, buying commodities. Yes, you might have everything, but if you don't have the commodities to use, the funding partners are not cheap. The vaccines that we need are not cheap. Nigeria currently is transitioning from Gavi, because initially Gavi was supporting Nigeria 100% in terms of immunization vaccines. But right now, because of the level where we're now not too poor to be supported fully, but rich enough to buy it ourselves. So Gavi has reached an agreement with Nigeria where we give you some part of money and you bring some on your own, and then we buy it together. In the hope that as years go by, it will be fully government funded. But right now, still, Nigeria has not been into that particular expenditure, and those are part of the capital funding to buy some of these vaccines. We are under the procurement is less than it should be, optimal levels, and who knows? And this might affect some of the things we are going right now. We have polio that is have been beaten back right now. We don't want a situation where in the coming years there are no more vaccines for polio and it comes back. That would be a huge blow for Nigeria.
Gavi is one of the donor agencies, and aside Gavi, we also have some other donor agencies in Nigeria who have been, giving some intervention funds. But there are also reports that they are likely to withdraw. So when these plans are on the ground, what can be done to fill in the gap locally by the federal government?
Yeah, that is why we are advocating for increase in funds allocation for health in order to cushion the gap which these donors will leave if they eventually disengage from supporting healthcare services. So it has to do with commitment, it has to do with fulfilling of campaign promises, because all the politicians, most often, they promise improvement in health, improvement in education. So it is now left for them to back up that commitment with implementation. Otherwise, there's going to be a huge gap when these donor agencies withdraw their support. And already we are feeling the impact, and that is why, if you notice, the shortfall, as doctor has mentioned, in respect of family planning, it has created a problem now, most of the people who want to have access for these contraceptives are finding it difficult because they are not sufficient as a result of the reduction in fund. And I think what emanated was that some of the donors observe that often they bring their own part of the contribution, but the government do not bring their own. So maybe it's like they are feeling tired, or they too, maybe they are getting exhausted. So I think the hallmark is that let there be that commitment by government.
At all levels, because recently I think the Bauchi State Governor ordered the payment of a counterpart funding to a particular donor agency. And
in fact, it's not that I'm from Kaduna State, but I want to say that if other governors can borrow from what the Kaduna State Governor is doing, because he was among the first states to implement primary health care under one roof, and presently he was among the first also to ensure that the state assess the basic health care provision fund.
Okay.
Yeah.
Thank you so much. Bartholowme Sarti is the Chairman, National Association of Nurses and Midwives of Nigeria, Project Director, PACFaH at Scale, Kaduna State. Thank you for talking to us. We've also had Dr. Stanley Elechukwu, Project Director, South Saharan Development Organization of the Partnership for Advocacy in Child and Family Health at Scale, PACFaH at Scale. Thank you so much for talking to us as well.
Thank you.
And thank you for being a part of the show. Return again tomorrow with another edition of Kakaaki, the African Voice. In the meantime, have a rewarding Monday. I am Salamatu Ibrahim.
But I'm Chiko Danka Eze. Have yourself a wonderful day.